second reading of Bill 33, an act to reduce the abuse of fentanyl patches. Mr. Fedeli.
The member for Nipissing.
Thank you, Speaker. Move second reading of Bill 33, an act to reduce the abuse of fentanyl patches.
Mr. Fedeli has moved second reading of Bill 33, an act to reduce the abuse of fentanyl patches. Pursuant to Standing Order 98, the member has 12 minutes for his presentation. The member for Nipissing.
Thank you very much, Speaker. Before I address the details of Bill 33, I'd first like to say that it's my firm belief that any time we can do something in this House that can literally save lives, we should do so. I stated that when we debated the Hawkins-Gignac Act on carbon monoxide detectors, which is now law. And I firmly believe that the Safeguarding Our Communities Act, or my Fentanyl Patch for Patch Act, will do likewise. Speaker, drugs are killing people throughout our province and into our cities. I want to read you an email I received from Sherry Albert of New Liskeard shortly after I introduced Bill 33 last fall. She wrote the following: Dear Vic, I am writing to express my gratitude for your undertaking of this initiative. In 2011, I lost my 19-year-old son to this tragic abuse of medication. He was a gentle young man with many plans who was at the wrong place at the wrong time, and as many others did not know the dangers of prescription medication. The police determined that the patch was sold to his friend for $100. Since May 2011, I have heard of at least 4 more senseless fentanyl-related deaths in our very small community. I, too, am afraid for our youth. I would like to extend my offer of support to this program by sharing my story with whomever cares enough to listen. My life has been forever changed and my heart eternally broken by the loss caused by this serious problem in our area. Speaker, the abuse of fentanyl is a growing and dangerous trend in Ontario. In fact, in North Bay alone, at least 15 deaths have been linked to fentanyl in recent years. 1 death is too many. 15 is a number this legislature cannot, with any measure of conscience, ignore. Fentanyl is a powerful pain medication that is sold in small patches via prescription. Like any opioid, it is prone to abuse. The patches are cut up and sold illicitly to addicts who have found ways to smoke, ingest, or inject the drug. When this program began, a full patch was going for $400 on the street. Since my community, and I'll talk about that in a moment, has introduced a patch-for-patch program, the cost has risen to $600 a patch. We are seeing an impact on our streets, and it is impacting our police services and resources. Last year, a North Bay man was arrested and charged with drug trafficking after police seized 59 patches with a street value of more than $23,000. In May 2014, Barrie police arrested 8 people connected to a fentanyl patch scheme with links to North Bay and Toronto. These are just a couple of examples of the serious crime issues, but I can tell you, and the officers from the North Bay Police Service can tell you, they were making arrests on a weekly, if not daily basis directly related to the trafficking of fentanyl patches. That's now been greatly reduced due to this patch-for-patch program. So not only are there serious health considerations, sale of these patches are empowering the criminal elements in communities across the province, straining our policing resources. The Ontario College of Pharmacists notes in the winter 2015 edition of their publication Pharmacy Connection that the Ontario Association of Chiefs of Police is leading this patch-for-patch initiative. It also notes that the Ontario College of Pharmacists and College of Physicians and Surgeons of Ontario both support initiatives that curb opioid abuse, including participation in the patch-for-patch program. Dr. Kieran Moore writes, quote, "As president of the Kingston Academy of Medicine, I am supportive of this bill. The patch-for-patch initiative is an important step in reducing deaths from accidental fentanyl overdoses, which have more than doubled in Ontario since 2008. So, Speaker, what is Bill 33 all about? What is a patch-for-patch policy? Well, I am joined today here in the legislature by the very folks who pioneered this patch-for-patch program in North Bay that has had such wonderful success in curbing the trend of drug abuse. Pat Cleash, a dear friend of mine, a lifelong friend of mine, of the North Bay Anti-Drug Strategy, is here today. North Bay Police Detective Constables Brad Rayum and Tom Robertson are here today. I welcome all of you for being here. In addition, Speaker, Carleen Varayan of the RBP Canada, who's very supportive of the program, is here today. We had a wonderful press conference, news conference at 1:15, and we are enjoying the support that has happened, I haven't even told you, between 1:15 and now, where the phone is ringing and the emails are coming in looking for how they can help. So we're thrilled. Speaker, Bill 33 would require a person prescribing fentanyl patches to record on the prescription the name and location of the pharmacy that will fill the prescription and to notify the pharmacy about the prescription. It also sets out various rules that apply to persons who dispense fentanyl patches, including a requirement that a new fentanyl patch may only be dispensed if the dispenser collects a used fentanyl patch from the patient or his or her authorized representative. It would also authorize the Lieutenant Governor and Council to make regulations. Basically, here's how the patch-for-patch has been working so successfully in North Bay and now in many other cities, and why it needs to be a legislated process across the province. This policy, developed in partnership with local doctors and pharmacists, stipulates that in order for patients to get a new fentanyl patch, they have to return the old one intact. Pretty simple. Pat and the others can tell you it has a positive effect in North Bay. Now, 22 other communities have adopted the patch-for-patch solution. 17 are in the process of adopting it, and 3 more are considering it. In Guelph, the Wellington Guelph Drug Strategy produced an informational video on the problem of fentanyl abuse last fall as part of their program launch. Other communities to get on board include Windsor, Peterborough, Sault Ste. Marie, St. Thomas, Sudbury, Timmins, and Muskoka. Right now, this is being done on a voluntary basis, community by community. It's a patchwork solution, if you'll pardon the pun. The problem is this. So long as a person has a means of transportation to get to a community without a patch-for-patch policy, they can still continue this chain of abuse. That's why it's so important to have a province-wide solution and why we've brought this bill forward. There are several other reasons to do this: to generate public education and awareness regarding fentanyl abuse and misuse, and to guarantee responsible provision of this potentially deadly drug, to address proper disposal of fentanyl patches to avoid harm to others, to address an identified increase in associated crime in the community, increases seen in the number of overdoses and mortality rates, the significant amount of medical resources these cases can use. The benefits of doing this are plentiful. Partnerships with law enforcement, physicians and pharmacists to ensure proper return and disposal of fentanyl patches, an anticipated reduction in accidental and non-accidental overdoses from fentanyl. A comprehensive evaluation is currently underway in North Bay, limiting the trafficking of fentanyl, eliminating the return of counterfeit fentanyl patches, and other issues around fentanyl use. Reduction of the amount of fentanyl on our streets assists local police as investigators require significant time and substantial police resources to build cases against those with a legitimate prescription. Assists local efforts to develop public education and awareness programs with various community partners. Benefits seen from sharing best practices among numerous areas across the province. Obviously, any such legislation needs to have a different component to be effective and enforceable. To address that, the bill provides a flexible response. For example, it would allow regulatory oversight bodies to determine if their members are adhering to professional conduct standards and to determine what, if any, action is required if those standards are not being upheld. As well, the bill gives the minister the power to make regulations to deal with a variety of issues that may arise. I have to say I was very pleased to receive a response from Minister Hoskins to my order paper question about fentanyl abuse. It stated, quote, "The ministry is supportive of this initiative as it is showing promise in reducing diversion and misuse of fentanyl in communities that have implemented it." Quote. I'd like to say to the minister, I'd like to work with you on moving forward on this. In closing, I want to say I believe the approach advocated in my Bill 33, which has already produced positive results in North Bay, is a model that will curb the dangerous and growing trend of fentanyl abuse across Ontario. This bill is about saving lives and helping the most vulnerable people in Ontario. Remember the words of Sherry Albert of New Liskeard and try to put yourself in her shoes. Thank you, Speaker.